Hi, very good evening to everybody. And today I have Dr. Swarna Prabha with me. And today we are going to discuss something very, very interesting. Thank you, Dr. Swarna Prabha, for joining in this conversation. And I think the last time we were speaking with our some of our interested people as well as our acquaintances, and therein I think we decided that we bring this, question answer session in the live in our channel for our audience as well, who would be from dental background, because I think you answered those questions so very nicely, and it's a lot of information, that we had grabbed at that particular conversation. Well, thank you once again for joining in this, and I think it will be a mind blowing session.
Definitely, Doc. I am also looking forward to this.
Great. So, jumping back to the questions directly, to all of you, our viewers who are watching this live or who will be watching this as a recording. So, we are going to talk about a very interesting area and a very, very thriving area in dental clinical practice, that is using dental lasers. Well, there are a lot of myths and facts, but I think some of the most common questions which came up when we both were discussing along with some of the participants in a different program. So from therein, we got all the questions and we thought that we'll share it with you. So bringing back to the questions, we need to understand certain things about lasers very clearly. So, Doc, my first question would be something like this, that, I asked you the other day also. So, it would be, the thing is that there are very typical things that needs to be understood when we are actually trying to step into, though, we can do some courses or even we get trained, but still when we are putting our money and purchasing a device or a instrument or whatever, the adjunct thing that will help us, so in that way, can you tell us that what should one, focus on, or one should need to understand about particularly dental lasers before purchasing a unit? Yeah.
Okay. See, before we invest in anything, majorly in our dental clinic, we try to understand what the equipment offers and what is it that differs with each company and all those. But with lasers, we need to, because there are many types of lasers, such as diode lasers, erbium, Nd:YAG, carbon dioxide lasers. So first, we need to understand what type of lasers we need for our practice. To understand what we need for our practice, we need to understand our type of practice first. Uh, for example, mine is a general practice. For some, it would be a specialized practice catering only to endodontics or oral surgical procedures, something like that. In that case, you need to uh, decide what are all the procedures that you will do with lasers before you invest in one. For example, if you will be doing more of minor surgical procedures, bleaching, and more of low level laser therapy, then you can go for diode lasers. Or if you want to use lasers exclusively for uh, tooth cutting procedures, even for cavity preparation, for also for surgical procedures, then you can opt for erbium lasers. Or if your practice is specifically more of surgical procedures, major surgical procedures as well, you can go in for a carbon dioxide laser. So you need to understand your practice as well as for what you will be using the lasers as well. And after that, you need to understand what are all the wavelengths, the energy that the machine can offer. So I mean, it's you need a specialized training before you invest in a laser machine. I would definitely say that you can straight away get a laser machine and start doing the procedures, but I would strongly recommend you undergo a training, some sort of training, to understand lasers, what they do, what they cannot do, what are all the hazards, what are all the safety procedures that you have to undergo, and with what wavelengths what you can achieve. And then you invest in one, because investing in lasers is no small money. So before you make that big decision, big investment, understand it completely and then do the right decision. That is what I would say.
Yeah, I think that is a very practical and real answer for everybody. And I think you have just pinned down on the, what is required. So definitely understanding as well as at least a basic training would be required. So doc, I was just like the day when we were talking, you were telling me some about one of your courses that are coming up. So, little bit, can you tell what is the module of that course and how exactly you have designed? So, can you tell us a little bit about the course and what is, I mean, how will you be conducting the course? Yeah,
So yes, I have courses planned up from 2023, that is from January. So it will be more of online method of learning, and it will be a module based course wherein you can learn in bit sized informations of what you want to know, and this will be more of practically oriented. So which can be used right away in your practice. So this is designed keeping the clinicians in mind, what they would want,
right,
and what they would want to learn. So, and since this is in module and since this is in module based, the duration will also be shorter, so this will not interfere with your routine practice or academics or anything with that. So, and I'll share the brochure shortly in my social media handles also.
correct. So, doc, like as you said, it is practically oriented because since you talked about training, so I was just interested to get a more elaborate view on this. So, like as you said that it will be practically oriented. So, will you be showing like real time cases which would be which you are doing, or I mean to say you will be teaching in that way, which will be in a recorded version maybe, but then anybody can
Yes,
access that video. I mean, whoever is enrolling, right?
yes, yes,
Okay, I think
definitely. There will be
that is a
videos of
very
the.
because I think then if somebody wants to really learn, they can go back again and again in the same video, right? Because which is not possible in a
Yes,
live setup. So I think
yes.
that's a very good idea. Well, coming back to another very pertinent question which is running in my mind, because I think we're talking about lasers and we're talking about investing in lasers. So trying to get some ROI by this kind of investment in our dental practice. So say somebody who is just beginning, okay, so because I think therein the decision making is little, it becomes little difficult. When you get experience it's fine, but then at the beginning level, so um, is there any recommendation like I would put the question like this, that what lasers would you recommend to somebody who is just a beginner?
Okay. So yes, as I mentioned in the previous question as well, for a beginner, I think it will mostly be more of a general dental practice wherein you don't take up major cases. I mean, I'm just saying the general view. I don't say that beginners don't do major procedures, but then it all depends on how confident you are in handling the cases. So, if you are a beginner and you feel that you want to enter into laser dentistry, but your budget is just slightly limited, in that case, a diode laser would be a good option. And even with diode lasers, companies are coming up with machines wherein you have a single wavelength, dual wavelength, or even triple wavelength. So and the cost varies according to these. So as in I said again, wherein depending on the budget and what all applications you want to use it, you can decide on the machine that you want to buy. So for beginners, definitely diode laser would be a good investment. But if you're looking for multiple applications wherein you want to use for hard and soft tissue as well, for surgical as well as for low level laser therapy, erbium can also be a good option. So that in that way these two would be a good option. Carbon dioxide can be used for majorly for surgical procedures, and even they are being brought up in cosmetic procedures. So that is why I said depending on what the beginner is best at.
It
they
will
can
depend
decide on
on
the question.
the type of practice the person is doing. Definitely, like as you said at the very beginning.
Exactly.
Yeah. So accordingly, somebody needs to decide. Yeah, I think that's very practical.
The
So
beginner, yes,
yeah,
beginner may have their own practice, or they may even be associated with some other doctor. In that case, the doctor may allocate only certain cases to the beginners. So depending on that, they can again take a call.
correct. Well, so I think it is very interesting always to speak with you, Dr. Swarna Prabha. Well, just if you do not know who is Dr. Swarna Prabha, to all my audience and viewers who are watching this video, just to give you a little, very less, although because of her, because she has an extensive experience of more than almost a decade now, because she has been for the past 9 years, she is she is practicing as a laser and aesthetic dentistry and in Tamil Nadu. Well, what I saw, Dr. Swarna Prabha, in you is that you stood out of the box a bit, where you aimed to make dentistry accessible to all, and you started your altogether a rural dental practice, which I think it's fascinating, because I think the vision that you have to give quality dental treatment, affordable quality dental treatment to everybody, I think that is wonderful. And at the same time, your passion to share your experience, the knowledge that you have gained with everybody is amazing. Well, I will come back to more questions to you, Dr. Swarna Prabha. Just for my viewers, I would like to mention that Dr. Swarna Prabha is a very qualified person when not only in dentistry but when it comes to specifically laser dentistry, because she has bagged a quite a few of the well-known fellowships, as well as well-known courses which she has done from in the different institutes which are based in Spain and also in India, and these are all very well known courses. Well, so coming back to you, Doctor, my next question would be that. There are certain things which we generally use in our clinic. Well, for example, as you said while answering one of the questions, that a beginner, you can buy a laser without any training, you can try your own hand, but I think sometimes I have personally seen this scenario also, like some people, some clinicians, they will buy a laser just that they get fascinated by seeing them in a conference, or maybe the salesperson convinces them well, and it just lies, because I think that's the point, that they might not be very confident in what to use, how to use, where to use. So the question where it comes in clinical practice is, where should I use it? So that is my next question to you, that if somebody is having a laser unit already, say, so how they decide, I mean, where should they use it, can you tell us something on this?
Yes, I'm very happy this question was put forward, because this is generally a confusion with many of the clinicians who already have a laser unit in their practice.
Correct.
We all must have had that trepidation when we first held the aeroter and did a cavity preparation, even in a typhoon. We would have had that trepidation. What if we would go wrong? What if we would cut our gloves? What would happen? So same way this happens in lasers as well. But then that is why I said undergoing a training is very important. uh, when we don't use something in our practice, it is going to lie idle, and we would not get a return on what we have invested. For example, you own 2 to 3 hand pieces in your clinic, and you don't take it out. You will not do the procedures, even a simple class 1 cavity preparation, or polishing, anything for that matter. Only when you use those equipments, you get a return on what you have invested. Similarly, when you already own a laser unit in your practice, you need to keep it out of the box, set it up as how you're going to use it, and then when each patient comes in, you can think about how you can utilize lasers in your practice. For example, you are doing a tooth preparation for a single unit crown, following which you will be taking an impression. You will definitely need a retraction cord or a paste. before you take an impression. So in that case, instead of a retraction cord, you can even use a laser to define the margin to retract the gingiva. So when you keep the unit out, keep it ready, you will know where to use it. When you keep it inside a box, you will have the laziness to take it out, set it up, and then use it. So in that way, you will definitely not use it. You will keep thinking about, okay, I'll use it in the next patient, I'll use it tomorrow, I'll use it next week, but then you will never open it up. And when you open it up after a couple of months, you will find you don't know a lot of things. You find some of the things are not working. You will blame the person who sold you the machine or the company. So you will ultimately lose the confidence in the unit. So what I would say is just keep it out, keep it ready, uh, just as you're about to use it, and then when the patient walks in and with the procedure that you're doing, you can definitely utilize it. So that is what I would advise. Otherwise, no, that is not going to happen.
I think you told a very pertinent principle here. You know, this reminds me of a book which I read quite few months back of James Clear. It's on atomic habits. It's just that everybody can read it. So what I learned from that book is that it's just the cues. You know, like you said, if I have to do something, I have to bring that thing into my habit. So bringing that laser machine into the eyes in our sight is very important, because then only we will at least some in the whole day sometime we will feel like grabbing that and play with it, at least at least see what is there and what is not there. So that is a fantastic thing that you said. I think this is really amazing, and I think I agree with you. Once it is boxed and put in the cupboard or drawer, it also goes out of the memory lane. Yeah. So that's a very fantastic way of explaining. I really appreciate your answer this way. So Dr. Swarna Prabha, another question which is very common in practice, which I must ask you, is that, and I have seen, like, it has been like a traditional system, like what we call as cautery. So the thing is that wherever a laser applicability, dental laser applicability is there, as far as I understand, cautery can also be used, and it can be rather little faster maybe than lasers. Then why should someone prefer lasers over cautery?
Yes, that is that is a very pertinent question, I would say. See, both cautery lasers can be used for ablation, for cutting purposes, even a scalpel also. But the major difference lies in healing part, wherein the lasers take care of all the inflammatory processes. So what happens is that the inflammation is controlled. You can proceed straight away with taking impressions or anything for that matter. Suppose you do a crown lengthening. When you do it with a laser and a cautery, the procedure is faster with cautery, and you can feel it actually that you're cutting the tissue. The same is not with the lasers. It is little slower, and you need the tactic to do it. That is what I would say. But and with both, you can take the impression immediately. But what happens is, because of the inflammation processes, the impression taken with the lasers, they are they are more accurate. With cautery, what happens is that, because the heat conduction reaches to far more deeper level, the inflammation is more. So there might be a discrepancy when you fit in the crown. So that is a possibility, one thing. And the second thing is, both heat and electrical conduction is more with cautery. So when you use a cautery, you will definitely require a local anesthetic injection prior to the procedure. And even with the healing process, the heat reaches at least up to 100 layers with cautery. But with lasers, it is just limited to about 5 to 10 layers of cells. So you can imagine how long the healing will happen and what would be the tissue reaction post the procedure. With scalpel also, the I mean, the cell layers is limited to how much the tissue is cut, but then you have to take care of bleeding and all that. So when comparing cautery with lasers, cautery is definitely faster, the tactile sensation is more, but compared with the inflammation and healing process, laser is far more advantageous to us. Because following a tooth preparation or something, with cautery you will definitely need to advise some medication, some analgesics, but with lasers you need not do that, because even while doing the procedure some amount of photobiomodulation is happening. So all that is taken care, there is little or no discomfort to the patient even when the anesthetic effect wears off.
Thank you so much for that very comprehensive answer. I think it is fascinating to understand the subtle differences that you have very well presented today, and I think this would be a very valuable information for anybody who is already doing lasers, or maybe is they are beginner, or they are trying to think in this direction to start. So thank you so much, Dr. Swarnaprabha, for that answer. And well, I just have one more question, which I was just hearing when we were discussing, like one of the participants, one of the students were asking. So I thought that I'll put this question to you today because I think it's a very good question. She was asking me that. Suppose while using the lasers, it's all about energy, it's all about photon, it's all about light energy. So what if she was telling me that, ma'am, what if suppose I irradiate excessive dose of energy to a particular area where I'm walking? So what would happen? Will that be, I mean, how do I handle if there is any will there be any complication at all, or what exactly it is? So since you are into hardcore clinical practice and you use lasers day in and day out, so doctor, can you tell me about this thing? I think this will be a very valuable addition to whatever the discussion we are doing at this point. Yeah.
Yes, definitely. So that is why you need to understand the basics of lasers. So, I mean, sorry for keeping on repeating the same thing, but it is very, very important because lasers are something wherein you produce a result on a tissue with the help of light. And light on interaction with tissue produces energy, which means heat. So when the energy is delivered onto the tissue, there's production of heat, which is transmitted to the tissue, immediate tissue as well as the underlying tissues. So when you don't calculate the amount of energy that you're irradiating to a surface, you may do more harm to the patient. For example, a patient comes with a swelling of tooth number 4, 6, for example, and I mean, following extraction or something. What you do is you administer a low level laser therapy on the outside for the amount of buccal tissues and the surface of the swelling. There is supposed to be a calculation on how much you need to irradiate the tissue. If you irradiate it more than that, say for example you have to irradiate this area for about 10 to 15 seconds. If you do it for longer time, what happens is you will do more harm. I'll tell you why. There is actually a law called Anschul's law, which these lasers follow, wherein you increase the amount of energy. I mean, there is a graph for that. I think I can share you when you attend these courses. So there is when you increase the amount of energy that you are giving to the tissue, the heat delivered is also more, and the interaction is also more. It reaches a point wherein you achieve the optimum effects. When you increase it further, what happens is the heat and the energy increases, but the effect, the positive effect what we are achieving, it goes on the negative side. You will elicit a unfavorable response. So what happens is when you when, as I said, suppose you have to irradiate this area for 15 seconds, and you irradiate it for 20 seconds, okay, the tissues can tolerate. You go for 25 seconds, the patient will say, I feel something hot on my face. You go for 30 seconds, the patient will say, I have pain. And you go further beyond, the patient will increase further more pain, wherein they will try to uh, try to disturb you, saying that no, stop it, please. So that is what happens. The patient will feel the warmth, and the warmth keeps increasing. They will feel it as something very hot on their face. And the tissues at the cellular level, what happens is the inflammation process, which has to happen favorably, wherein we want the swelling to come down. What happens is we will actually increase the swelling because of the excessive energy delivered. So when we don't deliver energy at the optimum levels to a tissue, we will definitely endanger the patient, and the patient will be able to feel it even under local anesthesia or not, because the changes are happening at a cellular level, because the lasers are all non-ionizing, and they can reach further levels of tissues due to their wavelengths, because the common wavelength that we use even with diode lasers is around 650 to 980 nanometers. So these wavelength lasers can definitely reach more deeper into the tissues. So the changes happen at the cellular level, and when we don't deliver a appropriate quantum of energy to the tissues, there will be an unfavorable outcome. So, and to understand how much should we deliver, or how do I know whether this is the correct quantum of energy, I can explain you all these in detail. This will all be discussed in the modules in the courses that I told you.
I think it is very, very interesting, and the way you explained step by step, breaking things and making us understand that what exactly would be the changes at the cellular level, or particularly, I like the area that how, for a clinician it is most importantly, even if we before go inside the cells, we will definitely have to tackle the patient response. So I think that was fantastic, Dr. Swarna Prabha. And well, at this point, I don't have any more questions. We can see if something is coming up in the chat. And well, I don't see at this moment any questions in the chat. But if but to my audience, if you have any questions later on, please put it in the comments, because this video will be there on this channel always. So Dr. Swarna Prabha can come and she can answer it as well, and I'll also help in that. And we are really looking forward to your course, and for that, you all you need to do is to follow our website www.jinden.com, wherein very soon you will be knowing more in detail about what would be covered in this course, and how you can access it, everything. So thank you, Dr. Swarna Prabha, for your time and for the wonderful explanation. I think we will come up every now and then in the near future for many such interesting discussions with you.
Definitely, I'm also looking forward to it, and it was my pleasure being a part of this AMA session.
Right, and I think the questions were from the from the more from the young people who are starting their career, or who are just 1 or 2 year experience, or maybe yeah, I think that was the range from where we all got all these questions, and it was a good idea to come up with all this in the conversation here. So well, so we'll keep meeting again and again, and we all look forward to your course on basics of laser dentistry, and the details very soon we will be having it on our website as well. Thank you so much, and take care everybody. Bye bye.